OMS warns of healthcare worker shortage in 55 countries amid COVID-19 crisis. The United Nations agency has raised concerns about the shortage of healthcare professionals in 55 countries worldwide, which is posing a threat to the achievement of universal health coverage by 2030, a critical promise of the Sustainable Development Goals. The crisis is most severe in African nations, with 37 countries on the continent experiencing a scarcity of healthcare workers. The role of wealthy nations belonging to the Organization for Economic Cooperation and Development, OECD, is under scrutiny in the OMS alert, among other regions. Recruitment Unit. In Africa, there is a vibrant economy that is creating new opportunities, said Dr. Jim Campbell, Director of Health Workforce Policy at the WHO. Gulf states traditionally depend on international personnel, and some high-income OECD countries have accelerated their recruitment and employment to respond to the pandemic and address loss of life, infections, and worker absences during the pandemic. To assist countries in safeguarding their vulnerable healthcare systems, the WHO has released an updated list of workforce safeguards and support, which highlights countries with a low number of qualified healthcare professionals. These countries require prioritized support for health workforce development and health system strengthening, along with additional safeguards that limit active international recruitment, insisted the WHO. Tedros' call. Supporting the call for universal health coverage for all countries, as per the Sustainable Development Goals, WHO Director General Tedros Adhanom Ghebreyesus urged all countries to respect the provisions of the WHO's Workforce Safeguards and Support List. Healthcare professionals are the backbone of all health systems, and yet 55 countries with some of the world's weakest health systems do not have enough, and many are losing their healthcare professionals to international migration, Tedros added. Commercial interest. Although many countries respect the existing WHO guidelines on healthcare worker recruitment, the principle is not universally accepted, warned the WHO. What we're seeing is that the majority of countries are respecting these provisions, by not actively recruiting in these vulnerable countries, said Campbell of the WHO. But there's also a private recruitment market, and we hope that they also reach some of the global standards that are provided in terms of practice and behavior. There are also mechanisms for governments or other individuals to notify the WHO if they are concerned about recruiters' behavior, the WHO official added. The WHO's Healthcare Workforce Support and Safeguards List does not prohibit international recruitment, but it recommends that governments involved in such programs be informed about the impact on the healthcare system in the countries where they hire qualified healthcare professionals.